Whereas there was no accurate prediction on when the next human influenza pandemic could occur, the world has been on a standby mode to swing into action just in case the virus makes a deadly comeback. This preparation, called Humanitarian Pandemic Preparedness Initiative, is a USAID global-funded program aimed at helping countries to prepare by building community resilience against human influenza, by improving public health, food security, and livelihoods by using non-pharmaceutical interventions. It is funded through the International Federation of the Red Cross and Red Crescent Societies. In Uganda, Uganda Red Cross is the lead implementer and CARE is the main implementing partner. Uganda Red Cross Society and CARE work with other partners like the National Task Force on Avian and Human Influenza, co-chaired by the Ministry of Health and Ministry of Agriculture, Animal Industry and Fisheries, local governments, as well as humanitarian agencies to prepare the country to have preparedness plans in case of a human pandemic. Uganda Red Cross is implementing H2P in 10 pilot districts of Busia, Tororo, Manafa, Kapchorwa, Gulu, Kitgum, Adjumani, Moyo, Yumbe, and Intungamo. However, the food security micro project is only in Kitgum. CARE works in 4 districts of Nebi, Arua, Koboko, and Maracha Terego, while the Ministry of Health works in the entire country. While Uganda has so far been spared by an attack of the deadly influenza AH1N1, this has even made the Uganda Red Cross and their partners accelerate further the prevention mechanisms and slowly but steadily sensitize the communities about the possible outbreak within our borders.
I must say that last year we launched a program that was focusing on the avian flu. And this program that we launched was what we call the H2P, which is Human Pandemic Preparedness. And at that time, it was envisaged that at a certain time T, there would be an influenza pandemic that could be through either birds or through animals. And as Uganda Red Cross Society, this program was basically a preparedness program, ensuring that we prepare communities that are along entry points in supporting them with sensitization, livelihood activities in a situation where there is a pandemic. So building on that, we suddenly find ourselves having an H1N1 virus and having to respond to it, because as you are aware, Uganda reported its first case, and of course as the case has been discharged, but that shows that we are at a risk of a pandemic and many people can get infected. So as an organization that has been in a preparedness situation for a possible outbreak, we think that there's a lot that we can do.
The areas that Red Cross, CARE, and the National Task Force has singled out as very risky or prone are entry points like the international airport. Entebbe, for example, receives flights that come from as far as eastern and western countries where the disease has been declared. In a bid to reduce the possibility of a possible H1N1 outbreak in the country, a health team from the National Task Force and the Ministry of Health, together with the Red Cross, through the former's volunteers, has established a desk at the arrivals lounge at the Entebbe International Airport to screen people jetting in the country. To make matters simpler, in some airlines, a brief medical health questionnaire is issued on flight so that one can fill it before they touch down, or better still, find it at the immigration desk. There is an efficient team here that will handle those arriving, taking into consideration that passengers could be tired as a result of jet lag due to long flights. But what exactly does one go through on arrival?
Any person, international traveler who arrives at Entebbe Airport is given a form to fill in, and we look at key symptoms. If this traveler or passenger says that he doesn't have those key symptoms, we look at his or her itinerary to see which countries he has visited. If these are countries where this disease has been reported, we interview that traveler in more detail. But if we get a person who is with the symptoms of H1N1, we subject this patient or this traveler to more detailed examination and investigation.
The team here, they can see, because for them they are medics, they know what they are doing, they have been trained in this, so they have the capacity to detect whether somebody has got the disease or not.
It is not just Entebbe that is ready, but other entry points like border districts of Malaba, Busia, and even Kitgum, which is about 550 kilometers north of the Ugandan capital Kampala, where communities are being sensitized on the influenza pandemic. Dr. Emmanuel Tenywa from WHO's Disease Control in Kitgum sums up the response strategy.
We do have the health workers who can manage this. The immediate response doesn't really mean that we do have to move out as a whole team. It is an issue of knowing exactly what to do. What are we supposed to do? We need basically to clearly come up with the actual diagnosis. Is it influenza A H1N1 or something else? So we shall go take the history, and then we get the specimen for shipping to confirm the diagnosis. Meanwhile, we shall be managing the case as per our clinical diagnosis. So the response, we are able to do that. In case of any other required support, we can always get from the national level.
But if there's no real threat here in Africa, why are we seeing this heightened alertness in rural Uganda? Is it worth the effort that has been put in by all these agencies? Dr. Tenywa's answer is distinct and clear. It's about prevention.
To give our people the clear messages before the disease even reaches them, such that we can avoid it entering our district or the country at large. That's why even our surveillance system, you can see they are screening at the airport to make sure that in case anybody came in, we can be able to know the contacts. Where has he gone? He has gone to such and such a place. So you can easily trace and know the possible people who can contract the disease. So we need to prepare ourselves and prepare the communities such that they can prevent contracting the disease. We don't have to wait the disease to really be declared present in the district, then we can embark on the prevention.
Messages have been designed that are giving case definition of the disease and how one could prevent it. Peter Opoka is the Uganda Red Cross branch coordinator for Kitgum. He's the man that has been leading the coordination in this northern district.
We actually explained the difference between the seasonal flu and the H1N1. And a lot of questions actually came out, and we responded to those questions. But the basic is that if you have a flu-like sickness, then you have to actually report it, so that because the case definition actually brings out the kind of flu that it's important that the trained medical workers actually specified it, whether it is H1N1 or the seasonal flu. Of course, all those are flu and they need to be treated.
All the FM radio stations that are popular in the region have frequently been visited by a team of experts to pass on the messages, facilitated by Uganda Red Cross. From the radio station to the border sub-county like Madipai, information is moving.
In April, when the phase of the pandemic was raised to 5, we initiated the pandemic influenza contingency plan, which we did it with the district, and as we talk now, We have also, as Uganda Red Cross, we have offered a radio talk show which we involve the district leadership. What we are doing now is actually to intensify the awareness on H1N1 influenza.
While the people are being equipped with this information, the Uganda Red Cross is also looking into food security and livelihoods. This is to improve the productivity of the people so that in case of a human pandemic, people have enough food to take them through that period.
When you are preparing for an outbreak, if there is a mass outbreak, it means that there is a serious disruption to the livelihood of people. And our project was designed in such a manner that it focuses on hygiene and sanitation on the one hand, and its promotion, and on livelihood support. If there is an outbreak, then a serious outbreak, people will be asked not to move from one place to the other. You've seen in some of these countries where people who have been moving from one country, like for example when it started in Mexico, people who wanted to go to other countries like China could not be allowed entry. So if there is a serious outbreak, it would mean that communities cannot move from one place to the other. And therefore, such communities must be self-sustaining. They must have the necessary food and the necessary livelihood support materials, because then there is a disruption in travel and movement. So that's why we combined a food security element in Kitgum as a pilot to see and prepare for such worst case scenarios.
Yes, exactly. When there is a pandemic influenza, it is very important that the people who are infected are supposed to take a lot of fluid. And where do they get the fluid? Now that is why we had a component where we were promoting the citrus, and in Madipe, which was actually is a frequent sub-county which is having outbreak, because if you see on record, cholera started from there, hepatitis started from there. So we started emphasizing the issue of the citrus in Madipe, so that in case of the outbreak, they are able to actually get some of the fruits locally, and also if they could grow enough food, because we supported them with ox plow and oxygen, and also the cassava cuts and groundnut seeds, so that they can produce more food and be sustainable, and they can be self-reliant, and since people are coming out of the IDP camps and so.
A group of farmers in Madipe have been selected to receive citrus trees that are being distributed across the district. However, not that every farmer had to receive these citrus trees. Popok explains the steps that were taken to choose these farmers.
In most of these sub-counties, we actually have what we call the Farmers Forum. Now, in the Farmers Forum, first of all, we have to identify people who are able to, because like the citrus is not easy. It's not easy to keep it, to grow it. So it needs a person who is actually interested in it first. But if that thing is multiplied, of course, if the citrus is within the community, it is easier to access it by any other sick person. So the people who were given the citrus, and the oxplow and so on, were people who are capable of actually producing, and they are interested in agricultural work.
The criteria included the most vulnerable households, ability to look after the inputs, accessibility to land for cultivation and rearing animals. Criteria for selecting the sub-county: sub-county bordering southern Sudan with fluid population movement, sub-county with high risk to disease outbreak. Madipe has been the epicenter for the frequent outbreak of diseases like cholera, meningitis, hepatitis, etc. These willing farmers who have shown commitment also once in a while meet at the sub-county headquarters from where they exchange ideas. Today, the Uganda Red Cross Kitgum branch officer is making his round of mobilization. Kitgum shares a border with Sudan, through these hills of Agoro in the north and Lawinyo Duny in Madipei and Ngomoromo in Lokung, where one could cross the border. But now the Ministry of Health, together with the Red Cross, is preparing to send a team of health officials and Red Cross volunteers to Uganda's border points so that they can screen people coming in like what is happening at Entebbe International Airport.
Of course, we started with the most dangerous entry points, which is Entebbe, because as you know, Entebbe brings in international travelers from all over the world. However, although there are some international travelers from these other border entry points like Busia, Malava, Arua, but we started with the most high risk, and now we are going to those borders soon.
Back here in Wigweng village, Madipei, we find Achiro Oriem weeding her crops. She has fenced off these trees to make sure goats and cows, or even wild animals, do not cross her garden. Apart from citrus, or fast-growing grafted mangoes and oranges, farmers in Madipei have also received oxen for use in plowing their fields. This is to build community resilience against human influenza and improve livelihood and food security in Lamu County, Kitgum district. We find the animals grazing in communal fields in Madipei. They could have made all these interventions, but that does not mean these agencies are not finding bottlenecks. Political leaders have been invited to participate in these talk shows on radio because of the respect they command, and their presence gives believability to the masses. But have they been trained on what to say, given the fact that they are not technical people on influenza?
Yes, before we actually went for sensitization, they were first of all oriented on H1N1.
All leaders have been oriented and they get weekly updates from the National Task Force.
From the time of the outbreak, we had